So let's break down this case study. So we look at the strip, and yeah, that's obviously, and everybody's kind of nailing it across all the socials. Yep, it's hyperkalemia. We'll see that peak T wave. And remember that peak T wave, to really kind of get in the mindset of hyperkalemia, is it needs to be at least half the amplitude of that QRS, roughly. Don't get out your calipers and worry about that specific. But just because it has a little peak on it, that might just be a printer setting, okay? But a peak T wave relative to that QRS. All right, so the choice was between albuterol, calcium, sodium bicarb, or furosemide. So all of those are awesome and frontline initial treatments for crush injury with hyper K, except D, furosemide. All right, so that albuterol helps in the to get potassium out of the extracellular space and put it back into the cells to essentially utilize it, metabolize it, break it down, and go about it. The calcium just kind of helps make the cells more stable. It reduces the irritability of the myocardium and lowers basically the threshold and potential for a lethal arrhythmia. You remember that's only for a short amount of time, so it could, change the ECG back, so just keep an eye on that. The sodium bicarbonate is going to be to treat that acidosis that's occurring during that crush injury. So remember, we're looking at, 1 or 2 hours for having major volume issues, at 3 to 4 hour for the rhabdo, the really acidotic states, and that hyper K kicking in. So that's why furosemide's not that great of a choice in that, because there's going to be renal impairment with that. With that hyper K, the kidneys can't filter it that well, starts getting into rhabdo, and then it kind of works on a whole different way within a furosemide of how the diuretic part works in the kidneys, a whole different aspect of what it needs to do. So ultimately, this patient's going to need dialysis, but furosemide is not that choice for that. So albuterol, calcium, sodium bicarb, also as well as insulin and glucose are main staple treatments in crush injury patients in the presence of hyper K.